IHME's Financing Global Health Report brings to our understanding of development assistance for health that is unique is its comprehensiveness. We bring in data on bilaterals, private philanthropies, and NGOs, and a number of other efforts that track development assistance for health do not cover all these different aspects. So that's very unique. For this year, especially, given the recent aid cuts, IHME has leveraged its ability to pool data from all sources and also leverage contacts at key global health institutions to generate estimates that incorporate the most up-to-date information regarding the announced cuts and its impact on the aid that will be available in order to produce timely and relevant development assistance for health estimates for policymakers and other relevant stakeholders. Our production process for the Financing Global Health reports annually involves two main pipelines. One pipeline that essentially generates development assistance for health estimates for each of the 17 international development agencies we cover. And the second pipeline that reconciles these estimates to ensure that we have accounted for any multiple transfers across agencies. This year in particular, we have developed estimates for 2025, which is the current year. And this is not something we have typically done in the past. To get the estimates for 2025, we gathered all media reports of aid cuts and preliminary budget allocation announcements from foreign assistance donors where those were available. And we applied these announced cuts as appropriate to our 2024 estimates and beyond. There are three main findings from the report. One, development assistance for health is dropping further in 2025. DAH peaked at around 80 billion in 2021 and fell to about 50 billion in 2024. In 2025, based on announced budget cuts to bilateral aid, we are expecting aid to decrease further to a global DAH of about 39.1 billion. And that's 21% less than the development assistance for health that was provided in 2024. And this is levels that are comparison to what was last seen in 2009. Two, multilateral development banks such as the World Bank's role as a disbursing entity for aid will increase in importance. This is partly because the current aid cuts have not impacted them or don't seem to have impacted them as much, at least for the ones that have been announced. And so that has, in our analysis, is showing that the multilateral banks will have an increased share in the total DAH disbursed. Lastly, our near-term forecast for DAH suggests a stagnation. We are not foreseeing in the near term any significant increase in DAH availability and are forecasting DAH to reach about 36.5 billion in 2030. Unfortunately, our initial analysis suggests that low-income countries that are typically most dependent on aid will be most affected, partly because due to various reasons, these same countries are those that are least likely able to independently fill the gap left through their own government resources. I can think of three potential pathways. So either countries commit more of their own resources to their health sectors going forward, essentially increasing domestic resources for health, or an increase in efficiency. So countries endeavoring to do more with the limited resources that will be currently available. Or the last option will be to cut services, which may not be ideal, but may become necessary in some instances.